Okay, good afternoon. We're going to be doing our presentation on the doctors that we interviewed. My doctor's name is William Thomas, and he practiced in La Habra, California.
And the doctor I interviewed, his name is Dr. Sako Cholakian, and his practice is located in North Hollywood.
Okay. And the first question that we asked the doc was how many years they've been in practice. And my doctor, William Thomas, has been in practice for the past 17 years.
Dr. Cholakian has been in practice for 12 years in the same location.
And the second question that we asked him was their belief on evidence-based medicine, and Dr. Thomas said that evidence-based was the only way that he practiced, which I thought was very interesting. But however, there is also that side of chiropractic that is based mostly on the holistic approach to the patient, whereas and the whole innate intelligence plays a role where there's really not enough evidence to back that up yet. However, there are results. So he uses both evidence-based and the whole philosophy of chiropractic.
Dr. Cholakian pretty much is very similar to Dr. Thomas. He only uses certain techniques that have been proven to treat the patients because he wants to ensure a positive feedback for them.
Okay. The third question I asked Dr. Thomas about the chiropractic professional trade publications, and this question just totally backed the second question up based on the evidence-based medicine, and he said that he followed a lot on dynamic chiropractic, which I thought was very interesting because I actually follow up with that one as well. And also CCA journal, ACA, JMPT, and he subscribes to a lot of like email. He receives email, all this stuff, and he also attends webinars, which I thought was very interesting. Not many docs have that much time, so I thought that was pretty cool.
Dr. Cholakian, pretty much he doesn't have too much time, but when he does, he reads ACA and the CCA journal, which I believe is a good thing as well, to continue following your career after you have been attending the school, to know what's going on and figure out other treatments or anything like that to help your patients.
Okay. And the next question, chiropractic or medical research publications. And Dr. Thomas says he usually skims through them, and he more than anything picks and chooses which ones he is most interested in and what's going to benefit his patients the most. So.
Yet again, Dr. Cholakian is, like I said, very busy. So when he does have the time, he will look into any article or journal and first read the summary. And if he's interested in it, he'll follow up and read the publication. And if he's even more interested in it, he'll do further research on it.
Okay. Next question is based on assessment questionnaires and if he uses them or not, and Dr. Thomas says he does, but mostly if the insurance companies require him to, and he usually asks the most common as far as like percentage and how much the treatment has helped out the patient, scale from 1 through 10, and how much they've improved. So that's what he based on his assessment questionnaires.
With Dr. Cholakian, he graduated from Cleveland Chiropractic in Los Angeles, and during his time when he graduated, they didn't really teach him it, so he doesn't use anything of that sort.
Okay, so based on a diagnosis-based clinical decision rules, and he said that he has the foundation of the diagnosis-based clinical decision rules, but however, it depends whether he uses them or not. So he mostly based it on what the patient feels, and whether the patient feels about 10% better after the first visit, then approximately after 10 visits, if they feel 25% better, then it would approximately take him about four treatments to. It just really depends. The decision.
Dr. Cholakian pretty much uses his experience to help guide him on how to treat the patient and how to set up a re-examination.
Okay, and the way that Dr. Thomas measures the improvement of the patient is a VAS, symptom-based percentage scales, like I said before. And I thought this was very interesting, the fact that he uses range of motion a lot, because this school, SCU, stresses range of motion a lot, which I think is very important. And the fact that the doctor that I interviewed stresses it just as much, I think is very, very, very nice. And he also uses orthopedic testing based on like how the patient will react to these exams, and thus like identify whether there's been improvement or not.
The way Dr. Cholakian goes about this is again by re-examination, palpatory findings, as well as orthopedic tests and neurological tests, and of course range of motion, to help him determine where the patient is at with their response to the treatment. So from that, he'll know how to follow up on it. So.
Okay. And decision tree. So Dr. Thomas says that pretty much if something doesn't seem right based on ortho tests and presentations and all that, what the patient presents to the doctor, he'll order either X-rays or MRIs. If nothing, then he really has no choice rather than to refer out, which I think is pretty nice, because there's a lot of docs who sometimes feel that their credibility might go down if they refer out, but other than that, he says that usually he doesn't really refer out too much either, because the patients that he sees are within his scope of practice. So that's pretty cool too. He's confident, yet at the same time he's not afraid to refer out whatever's best for the patient.
So with Dr. Cholakian, what he does is he pretty much goes upon how the patient, what the patient says. So depending on what the patient is complaining about, he'll go about and doing a certain treatment for that and see what the outcome is. And again, if the outcome is beneficial, he'll continue doing the same treatment. If not, he'll do another treatment or he'll refer out.
And as far as treatment guidelines, Dr. Thomas said that he's a QME. So he's also within that, he's required to use the ACOEM, and he's also said he's familiar with the ODG. But he also uses them as a guideline. So I thought this was pretty interesting. Unfortunately, they are a guideline with work comp in California. It is now the law, not just a guideline, and patients don't always fit in the cookie cutter mold. So if treatment falls outside of the guidelines, there should be adequate justification.
Dr. Cholakian just again goes about with the patient's response to the treatment.
And as far as educational tools, this is pretty nice that Dr. Thomas keeps himself educated even after 17 years of practice. He uses Medline, and he researches things on his own just to keep himself informed and up to date to what's going on the chiropractic field, and which ways to help the patient respond to treatment better. So he also uses Google alerts, and anything that he finds interesting and helpful, he actually posts it on his Facebook and Twitter, which I follow him on that. So a lot of the things that he shares is actually really, really neat.
Dr. Cholakian says that he hasn't come across any tools, which I kind of agree and disagree. So like for example, me, if I was in a situation and I found something more interesting that maybe I couldn't treat, so I referred them out, I would do more research on it to see what I could do as a practitioner, or what I could what I could do to help out the patient, pretty much. Yeah.
Okay, and also to add on to the presentation, I actually pulled up Dr. William Thomas's website, and it's actually very interesting the way that he's developed it. It looks so neat, and he has Dr. T. He has about the practice, about himself, about his services, about chiropractic, massage therapy, physiotherapy, sports physicals, information. He even has articles, which interested me a lot because we read a lot of articles in this course, and just newsletters and questions. What is chiropractic? Conditions that he treats. The first visit and how long do you need to come in for, and so on and so forth. He also sells pain relief products as far as pillow and how to contact him. So I thought it was very interesting how he markets himself and how he's bringing out the chiropractic profession out there. So thank you.
Thank you.